What's up, guys? Welcome to BFR Tuesday. Merry Christmas, Happy New Year, Happy Hanukkah, all the stuff, holidays. Hope everybody is doing well. We are doing well. We're doing okay. Okay, so my name's Ed. I do this every Tuesday to answer any questions regarding blood flow restriction training. If there isn't any questions, then I will talk about whatever I want to talk about. So if there are questions, you can just type them into the message area. Upper right corner says chat. I'll say hello from Dallas, Texas. And yeah, so I'll give everybody a couple seconds and they can plug in any question that they have. Otherwise, I'll talk about what I plan on talking about. Check out that cup. Love this cup. Okay. Any questions? All right, maybe I'll stir some questions. So I got some questions online this week regarding ischemic preconditioning protocols. So ischemic preconditioning. Hey, Louis, good to see you. Ischemic preconditioning is a passive modality. So we use blood flow restriction, very high pressures. So we prefer about 100% limb occlusion pressure, but anywhere between 80% and 100% limb occlusion pressure. Most of the time we're doing this on the lower extremity, and we do it prior to high intensity exercise to reduce the amount of exercise induced muscle damage so that our recovery time is shorter. So I call it a recovery technique, but it's not post-exercise, it's pre-exercise. And so, can't hear me. My microphone's on. Can everybody else hear me? Well, this is good here. So it must be on your end, Doug, sorry. So I'm gonna show a video on how to do ischemic preconditioning. There's two different ways that we do it. We do it for recovery, and then we also do it for performance. So even though the ischemic preconditioning protocol is essentially the same, high pressures, 5 minutes on, 3 minutes off for 4 to 5 rounds, my intent might be different, although I'm using the same protocol. Just like another example would be in the clinic dry needling. I'm using the same needle as I use for acupuncture, right? The needles are the same, but my intent is different. Dry needling, I'm doing it specifically for a certain muscle or muscle group or a tendon. If I'm doing acupuncture, then I'm using the same needle, but I'm doing it more for meridians and circulation and nervous system effects. So anyway, hopefully that makes sense. So ischemic preconditioning protocol. So I'm going to share my screen and I'm going to show a video on how to do this. Sorry, I got this new Mac and it's asking me for permissions to do what I want to do. All right. Okay. Let's see if I can share it now. All right.
Hey guys, in this video, I'm going to demonstrate how to use the Smart Cuff Gen 3 Pro cuffs for something we call ischemic preconditioning, or IPC. So IPC is utilized prior to high intensity exercise, and what the literature has suggested is that it helps to reduce the exercise muscle damage induced by heavy intense exercise. So I'm going to use these cuffs. I'm going to put the cuffs on first. use the appropriate size cuff. In my case, I use a large cuff because my thigh is larger than 23.5 inches. I don't have to worry about using the little ears, the little tags, because I'm not going to be exercising with this protocol. This protocol is totally done passively prior to heavy intense exercise. If you notice, I'm going to make my life a lot easier by having, oops, I did it backwards. I was just saying it. But I'm going to make my life a lot easier by having the stem facing forward. You'll see why in a second. And I'm going to bring these cuffs up as high as I can go. And you're going to make them as tight as you can before laying down. So in my clinic in Dallas, we have these things called recovery pods. We have a couple of them. We do IV therapy in here. We do things like this. We do neuroacoustic deep meditative state training. We do Normatech. We do a bunch of different things. So it makes it convenient for me and my patients to be able to do this type of training here. So I'm going to slide into my recovery pod. This one got a little bit, so I'm going to just tighten it up a little bit more. All right, so now I've got my Pro pumps. You need a Pro pump in order to do this because just the Gen 3 cuff does not, or the Gen 3 pump does not have the ischemic preconditioning setting on it because we're using very high intensities. So from here, I'm going to connect, and I'm going to connect on this side as well. I'm going to face it this way so you can see. I'm going to go to update. I'm going to go to start exercise. I'm going to go to leg. I'm going to go down to IPC, and I'm going to hit enter, and I'm going to let this inflate. And I'm going to do the same thing on this other side. Start exercise, go down to leg, and I'm going to scroll down to IPC, and I'm going to let it inflate. Now these are going to about 100% limb occlusion pressure, so it's a lot of pressure. That's why we can't exercise with it. We're essentially occluding arterial and venous blood flow in both directions. We're going to stay in here for 5 minutes, and then the cuffs are automatically going to deflate after 5 minutes. We're going to take a 3 to 5 minute break in between, then they're going to reinflate. We do 3 to 5 rounds of this. Then within 45 minutes, we go and we do our high intensity exercise. Those high intensity exercise, whether it's squats or it's sprinting or it's something else, plyometrics maybe. This will help to reduce the muscle damage, so that way we can train more regularly, faster. I won't get the soreness that I typically would tomorrow. So that's how to do it.
All right, so ischemic preconditioning. Okay, so let me see. Any questions about ischemic preconditioning before I... so Lewis is actually, this protocol is available with the Pro units only. Yeah, that's true. And it's because of the high pressures. Now you can mimic it with the consumer version. You'll just have to use high pressure. And you're going to be pretty close. You're going to be at 80% LOP, so it won't be as much pressure as the 100% LOP when we do it with the Pro version. And I would also add electric stim to it as well. So I would use e-stim connected to the vastus medialis oblique and the vastus lateralis of the quad, and use some mechanical tension with contraction. You can use a complex unit, you can use a TENS unit, you can use power dots, you can use whatever you like. But you'll need to cook the area a little bit more. You also need to cook the area a little bit more when you're using this on high level athletes. So if you have high-level university athletes, pro athletes, Olympic athletes, you're going to combine ischemic preconditioning with electric stimulation in order to get the outcome. If you take my level 2 course, I go through all the research with that on why that the protocol is what it is. They've tried to do lower pressures, doesn't work. They've tried to do less sets than, like between 4 and 5, doesn't work. So there's a method to the madness when it comes to recovery. Okay, so I got some questions here, so I want to answer them. Let's see, Doug asks, can't hear for some reason. Okay, is there any study evidence that shows that high intensity exercise has helped cure, heal injuries as long as you don't re-injure the area? BFR did it for my shoulder when I was doing high intensity workouts for my knee. So I think what you're asking, Doug, and tell me if I'm not interpreting the question correctly. If we're doing exercise, let's say for the lower extremity, or we're doing BFR for the lower extremity, do we get a benefit in the upper extremity? And the answer is yes. There is evidence that, like I'm thinking of a study by Clark in 2012, where they only did BFR in the lower extremity, and then they tested 1 rep max in the bench press, and they saw increases in the upper extremity. So we do see a systemic effect. Some BFR experts don't think it's as big as a lot of us think it is. I don't know how much there is. I think there's more evidence that needs to be published on it. But like what I'll do for patients that have lower back condition, I'll get them on the treadmill and walking with BFR, and then do without BFR, then do their whatever core work that I'm doing with them, bird dog, plank, side plank. And I do think that I get better outcomes by using BFR pre my core stabilization exercises. So to answer your question, just to summarize, yes, you can use the cuffs in a different area and get benefits in areas that may be tweaked or injured. Lewis, observation, I'm doing a hypertrophy cycle. I recalculated my 1 rep max and shot for the lighter end of the resistance range, accompanied by a shorter rest period of 30 seconds. I was using 36 seconds previously, more resistance. It's early, but it feels like I'm getting better results, at least not worse. And less, yeah. So you're not gonna have as much soreness with lighter loads. And if you want size, hypertrophy, there's an inverse relationship between resistance and pressure. So the more pressure I use, the less weight I'm going to be able to use. So with hypertrophy, we want to use lower loads, higher pressures. And then the reverse is true when we're wanting to do strength. Anytime our body is trying to strengthen, the more mechanical tension that we apply, the better. Mechanical tension meaning load, or combination of load with reps and sets is volume. So we want to try to increase the resistance. Now, we don't want to go above 40% of your 1 rep max for strength. But if you're on a hypertrophy cycle, absolutely keep the weights low, keep the pressures high, and don't go to failure. And you'll get super early results too, like 2 to 3 weeks, you'll start to see muscle strength gains. Muscle size gains. So that's a great observation. Thanks for sharing that. Any other questions today? Yeah, if you're not getting results, then typically it's going to mean that your body is not getting tired enough. You're not creating enough fatigue, and so increasing the load. And again, that's an inverse relationship. I can increase the load or I can increase the pressure. Either one is going to create earlier fatigue. So in your case, by recalculating your 1 rep max, it's super important, because if you're not, then you might only be at 15% of your 1 rep max after 4 to 6 weeks of doing BFR, because you're going to get these early adaptations. So retesting your 1 rep max every 4 weeks is important if you're really truly trying to train the organism. Maybe I was using too much resistance and effectively overtraining. It's possible that, if we use too much resistance, you get what's called the muscle pumping effect, and you won't create as much metabolic buildup in the tissue, meaning what Dr. Lonicki's, one of Dr. Lonicki's studies, he compared 80% 1 rep max to 40% and to 20%. And what he found is that at the higher pressures, space is created and you lose metabolites, and metabolites help that early fatigue, that buildup. And so you don't want that muscle pumping effect with the higher loads. And there's no reason to do higher loads with BFR. If you're going to do higher loads, might as well just do higher loads and go to failure, 1 or 2 reps to failure. But ultimately, we're all different, right? In rest and nutrition and hydration and volume and all this stuff plays a role as well. And we can't discount that me at 48 is not going to be as effective for strength and hypertrophy as somebody in their 20s. It's just not the way it is. So everybody's different. You got to kind of figure out by playing around a little bit. I give you guidelines and a framework, but by no means do I think that's the absolute. Yeah, absolutely. Sleep is, we get gains when we rest, not while during the exercise. So sleep is super important. All right, awesome. This was a great conversation. It's 1:15. I've got a little time for my lunch, so I'm going to call it. I'll be back on next week. I'm in the office, just taking Christmas Eve and Christmas off. So I don't see any reason why not to do this next week. Thank you guys so much for joining and the great questions and comments. Have a great holiday. Be safe. Enjoy your family. And thank you so much for your support. I really, truly appreciate it. And if you haven't yet, go on to my YouTube channel where I post all these afterwards, and like it and subscribe. It really helps me out. I'm over 1,000 people now, and it just helps. So thanks so much. Happy holidays. Merry Christmas. Happy New Year. Talk to you soon. Bye.